Hello, I'm Ai Makaraig. Welcome to Rappler Talk. 2 years after the controversial reproductive health law passed, access to contraceptives remains a challenge for poor Filipino women. The United Nations criticizes the Philippine government for failing to prioritize women's rights over religious ideology and cultural stereotypes. What are the chances of lifting the strict criminalization of abortion in predominantly Catholic Philippines? How should the Philippine government act on the UN report? Joining us is Pyle Shah, Senior Legal Advisor of the New York-based Center for Reproductive Rights, to discuss this issue. Welcome to Rappler.
Hi, thank you.
Okay, first let's talk about the UN report. It focuses on executive orders in the city of Manila and basically says these are discriminatory to women. Could you tell us how your group raised these orders to the UN and what the report means?
Sure. So this inquiry report was actually based on research that was done by the Center for Reproductive Rights along with local partners in the Philippines, investigating the impact of these executive orders on women's lives. So back in 2007, together with local organizations, we published a report called Imposing Misery that documented the experiences of women in the city of Manila living under these executive orders and what it meant for them. The very real challenges that women faced in terms of, planning their families, women with 7, 8 children, really in desperate circumstances, trying to support their children, trying to ensure their children could eat and survive, and having to make very difficult decisions between purchasing food and purchasing contraceptives. Women told us stories about the abuse that they faced when they were forced to turn down sex with their husbands to avoid getting pregnant. Women talked about even the fear that they felt when they knew that a pregnancy, they'd been told by a doctor that a pregnancy would be dangerous for their health, and yet they had no means to prevent that pregnancy. So after speaking with women, the women themselves also were very upset about what was happening under this executive order, and local Philippine groups started to talk about what should be done. So the Philippine-based CDAW Task Force CDAW Inquiry actually was interested in the idea of pursuing an inquiry, which is a procedure under the Women's Convention at the UN, whereby experts from the Commission come here to the country and, with the consent of the government, meet with women, meet with government officials, and try to understand exactly what's happening and why it's resulting in women's rights violations. And so, based on this, on the inquiry, on the research that we did, we filed a submission together with ERA Asia Pacific, so the Center for Reproductive Rights, along with ERA Asia Pacific and the Task Force CDAW Inquiry, the Philippine Coalition, to have the committee members come here and see what was happening and really try to understand, is this leading to human rights violations, and how and what should be done about it. So the committee ended up coming in 2012. In November 2012, and they spent about a week here speaking with government officials, with health officials, visiting health centers and visiting women's communities, and actually spending, talking to about 60 women in Manila about their experiences. And as a result of that, they recently in April just published this report where they discussed what exactly was going on, and they found the Philippine government accountable for human rights violations as a result of its continued tolerance of the executive orders, and for other restrictive policies and the lack of enforcement of the reproductive health law and even the Magna Carta of women.
Okay. So for the benefit of our viewers, these two executive orders were under two different mayors. So the first was former Mayor Lito Atienza and the second is former Mayor Alfredo Lim. So the first order, the Atienza one, actually effectively banned access to modern contraception, so things like condoms, and the second one banned funding for these contraceptives. So this is, you call it a groundbreaking UN report. What makes it historic in a way, and what do you think is the impact for women in the Philippines and in the region?
So what makes this groundbreaking is that it's the first time that a UN body has issued such a comprehensive report on women's rights to contraceptives and reproductive health services in this way. And this is the first report done by the CDAW committee, this Women's Rights Committee, on contraceptive information and services. It's the first one in Asia. And so it really stands out as, as highlighting that this is a very serious human rights violation occurring globally, as well as in the region. The last report that came out publicly on by this committee was actually on the abductions, rapes, murders of women in Mexico. And the CEDAW committee, by issuing this report, really made it clear that they view what's happening in the Philippines as on par with that type of violence against women.
Abductions,
and killings. And it's because what they understand is happening in the Philippines is that women's lives are being devalued, that women are being denied healthcare services that they need for their survival, for their dignity, for their ability to escape poverty, to provide for their families. And it's a fundamental issue for women. It's not just, sort of a lifestyle thing. It's something that really every day impacts women's lives, and they are putting it on that level.
Talking about reproductive health and women's rights, we recently have that experience of going through the struggle of passing the reproductive health law. How do you assess the situation now after the law was passed, after this report came out? Are things better for women? Do poor women have more access now to the full range of services?
I think the passage of the reproductive health law was a historic moment, both in the Philippines as well as globally. That the recognition of women's rights to access contraceptive information services and other reproductive health care, including post-abortion care, was really, really groundbreaking. But I think it's been interesting. The law was passed, it was challenged in the Supreme Court, and then the decision came out upholding the law's constitutionality.
Right. After
that, there's been a lot of silence, I think, about what's happening with the law, whether it's, is it being implemented? Are women actually able to access services, practically speaking? And when we speak to women in the community, we talk a lot to our partner organizations, and they say, yes, there are some health centers where there are now more access to contraceptives, but we continue to see that many of the most vulnerable women still don't have access, that women are either not aware that the policies have changed. They're not aware that contraceptives may be available, practically speaking, right? But also that adolescent girls, for example, continue to face serious problems in accessing contraceptives. There still continues to be high rates of adolescent pregnancies, and our partners report meeting girls that are 19 and have already had 3 pregnancies, or 21 and also have had multiple pregnancies. And so we still see that there are barriers, but also that I remember being here during the last election. I remember
2013.
And it was a huge issue even then, right?
That it's an election issue.
Yeah.
Team Patay, Team Buhay.
Right.
That's how the church.
It's how it was. Yeah. and now it feels like there's a lot more silence around the issue. You can open the newspaper and you could easily read the whole newspaper and not see reproductive health mentioned once. And in part, it's great that there's been so much consensus. The law's been passed. But now, what I think this report represents is an opportunity to prioritize implementation. It's a call to action to the government. It's now time to really implement what's in the RH law, but also to take other steps to think about how to improve, things like access to emergency contraception, which the RH law does not actually guarantee.
Yes. So you talk about the laws. It's said about the Philippines, we have a lot of good laws, but the problem is always implementation. And for this particular report, the UN identified the problem of the devolution of health services, that when health services like reproductive health are given to the local governments, there's not much consistency. Like you can have Manila banning modern contraception, but in other localities, that's not the case. How do you ensure that national laws are implemented down to the local level?
Yeah, so I think the committee has spoken about this very clearly, and what they said is the attempt, any attempt by the government to say that devolution is the reason that women face barriers is not acceptable. That ultimately the national government has obligations under the international treaties, but also even under their own constitutional protections, constitutional obligations to ensure that women have access to contraceptives on a practical level. And even if it's a local government that is passing these types of ordinances, even if they have that authority, ultimately the national government is responsible for ensuring women's equality, right? Even it's part of the Constitution, women's rights to equality and non-discrimination. And so the national government has to ensure that even at the local level, such ordinances are not allowed to stand. And so even here in the Philippines, we've seen the Commission on Human Rights itself has reviewed the executive order. And they themselves have said it's a violation of women's rights. It's a violation of the Constitution and of the CEDAW Convention. And yet, it has been allowed to continue to stand, and really there hasn't been any action over successive mayors, as you mentioned.
And as your group said, it even inspired other local governments to copy the executive orders.
Yes, and I think as long as it's allowed to stand, as long as it's not revoked, it's going to continue to allow and inspire those types of actions. It's going to be seen as a model of how, how LGUs can control and deprive women of their reproductive health services. And so we've seen even earlier this year in Sorsogon City, there was another executive order passed declaring the city pro-life. And under that ordinance, the city was conducting trainings, equating contraception with abortion, and stigmatizing again a health service that women really need.
Okay, there's one interesting recommendation in the UN report. It says, let me read it, to develop strategies to sensitize government officials to eliminate ideological barriers limiting access to reproductive health services. So basically it says religion, ideology. So in the Philippines, the Catholic leadership plays a lot of role in terms of issues, how issues are interpreted by lawmakers or by the people. How do you think this can be addressed in terms of pushing for more reproductive health services for women?
Human rights law is very clear. Religious ideology cannot be used to justify discrimination. So, you cannot say, okay, our country has a very strong population of a certain religion, and that means that we can deny women healthcare that they need. What the CEDAW committee has really said is that that the government needs to ensure that women's equality is prioritized, no matter the religious ideology, the prevalent religious ideology. Practically speaking, I think there needs to be, as the committee said, sensitization, and that could be done, I think, through various government bodies. I think that it potentially is something that can be done even from a gender perspective, understanding why it is that health policies need to be based on medicine and science and not on religion. But even things like outreach to health, like to doctors and healthcare workers, and this is something even the DOH could consider. I mean, I myself have been part of trainings with doctors and nurses that provide post-abortion care.
Okay.
And what I've found is actually, at first, the doctors and nurses, they're very nervous about this. They worry, okay, this woman has had an abortion. Am I somehow helping her do this? Am I somehow aiding and abetting her? No, post-abortion care.
To a crime.
Right, they're worried, but actually the law is very clear. Post-abortion care is legal. It's legal under the RH law. It's legal under the Magna Carta of Women. There's even been administrative orders, going way back that talk about actually women's rights to humane, quality post-abortion care. And when you talk to healthcare workers about, you wouldn't, if somebody came in with a gunshot wound, even if they'd done something illegal, you wouldn't say, I'm not going to treat you. You just wouldn't do that. As a doctor or as a nurse, as a healthcare worker, you would provide them with the care, and that's part of your ethical obligation too, right? And really, your religious views or your view of what's right and wrong, ultimately, that's not what this is about, right? This is actually about caring for women, about giving them the healthcare services that they need, even basic respect for their lives, right? This is a woman who could die. And if you're turning down services, if you're harassing her such that it actually makes her not want to come in and get the medical care she needs, what is that saying, right, about what her life is worth? So, I mean, I think that there's even these practical conversations that could be had and could be part of even education and, medical education and things like that. And the DOH could play a role. So these are just some examples, but, practically speaking, I think there's many ways.
You mentioned abortion, and that's still a huge issue in the Philippines. And one of the recommendations of the report was to decriminalize abortion for particular cases like rape, incest, or when the health or the life of the mother is at risk. How do you think we can move this conversation forward in the Philippines, considering that stigma that comes with abortion, and it's not really being talked about, especially, politically it could be a very touchy topic.
Yeah, I think it definitely is a topic that is very taboo. I think that people are quite uncomfortable talking about it. There's right now the penal code amendments to the penal code are being considered, and I think one thing that we've actually seen is that the way it looks currently, that the penalties may actually be increased for abortion. That's what exists in the current draft, and that's really problematic. I think, there's definitely I think people are not necessarily aware how common abortion is here, that there's 610,000 abortions a year here in the Philippines, most of which are unsafe because of the fact that abortion is illegal. 1,000 women die each year from unsafe abortion here. And these numbers are increasing, actually. So in the past several years, the number has actually gone up by about 100,000. So there needs to be more, I think, awareness of why women are left in this position, why it is that they need to access abortion services, and why it is that, for women, these choices aren't easy, especially in a place where I think abortion is so stigmatized. When we speak with women, I remember talking to women who literally, maybe they became pregnant as a result of violence, and they just really, the mental trauma it would cause them to continue the pregnancy is so significant. Or speaking with women who talk about having already 7 children, not having access to contraceptives. I met one woman who was talking to us about not having access to contraceptives. Then she became pregnant. She ended up inducing an unsafe abortion. And then when she had complications, she went to the hospital and ended up being tied to the bed.
Really?
Yeah, really, because the doctors, I think it was an attempt in a way to punish her, right? For you did this, now you're forcing us to be part of it, and refusing to see it as a health service that women needed, and that she was just trying to survive.
Okay, can you give us a global picture of reproductive health and where the Philippines stands? A lot of people are proud of saying that in the Philippines, gender equality, women's empowerment we've already made strides in those areas. But if you talk about issues like maternal mortality or reproductive health, that doesn't seem to be the case. So globally, where would you situate the Philippines?
Yeah, I think the Philippines, in some ways, things like the RH law, they're very, there's many progressive elements about it, right? Guaranteeing free access to contraceptives. That's such an amazing guarantee, and it's not something you see everywhere. But then you have things like the executive order, which effectively ban contraception. And it's such an extreme. I think the provisions on abortion are by far one of the most extreme in the world.
Really?
The Philippines bans abortion without any clear exceptions, and that's not something you see. Usually, there's at least a life exception. Even Ireland, other countries that have similar constitutional provisions, similar. Even populations with religious beliefs, in practice they actually allow abortion in certain cases. And it's interesting, the colonial legacy, right? That this is actually rooted in even the provisions in the penal code. They come from the Spanish. But if you look at Spain or you look at Latin America, there are many countries that actually are more progressive. And whereas the Philippines has held on to these colonial provisions. And so, I think it does stand out as being a place where a lot of very conservative laws on reproductive health continue to exist, and where women's bodies are controlled in a very specific way. I think, and even on gender indicators, when you look at the Millennium Development Goals, right, where the Philippine government is committed to certain indicators of progress, maternal mortality is one that they're very, very, maternal mortality is increasing. More women are dying as a result of pregnancy now than they were a few years ago, which is backwards. Most countries in the world are actually improving. Globally, maternal deaths are down. So why is that happening here?
What happens if the Philippines does not adopt the recommendations? Like, what to you would be the next steps after this report was released?
Yeah. I think what's great about this report is it actually is a call to action to the government. It lists many very concrete steps on what needs to be done. And there's going to be several opportunities for the Philippines to be asked about what it's doing. at the international level, the CEDAW committee, which is the committee that conducted this inquiry, they're going to be reviewing the Philippines again next year.
Next year, okay.
And so the Philippine government will be in Geneva, sitting in front of the experts, including perhaps the ones that conducted the inquiry, and being asked, what did you do? What's being done? The Philippines is also going to be reviewed at the Universal Periodic Review, which is done by the Human Rights Council, which is another UN body that's made up of governments. It's different governments actually sit on the council, and they'll ask the Philippines questions. And actually in the past, the Philippines has gone through these processes, and in almost every one of these processes, they've been asked about reproductive health.
It's a recurring issue.
It's a recurring issue. It's something that international bodies and experts are very aware of, and there's been a lot of conversation about why is it that these issues continue to persist? Why does the Philippines continue to have such restrictive laws? And I think that even in the Human Rights Committee just recently came out asking the government to revoke the executive orders very specifically. And you might think this is a local ordinance.
Yeah.
How
why
is
would
it
the UN
getting?
be
Yes,
involved?
but it's so extreme. It is something that really you don't see in most of the world. This kind of restriction. I mean, literally pills, condoms, and when the executive order 003 was first put in place, it not only affected public health facilities, but also resulted in NGOs and private health clinics to not be able to provide the service. So the impact has actually also been very profound. I mean, I remember meeting a woman just actually in 2012. She was talking to me about how, when the EO was first passed, she wasn't able to access contraceptives. She had several unplanned pregnancies. And then she introduced me to her daughter, who was very young, and actually also herself did not have access to contraceptives, living in Manila, and herself was pregnant as a teenager.
So generations
of women. I mean, and I think globally that's not something that's lost, right? To have generations of women facing unplanned, unwanted pregnancies, risk to their lives and health, that's egregious. And I mean, I think as the committee called it, it's grave. It's a grave violation of women's rights.
Systematic
And it's
violation.
systematic. Yeah, I mean, it's a deliberate policy, right? It was intended to deny women contraceptives. It's not an accident that that's what happened.
Okay, finally, I want to ask you about elections, because the report seems to reflect that notion that the political leadership largely influences health policy, reproductive health policy, and women's rights. So we have presidential elections coming up next year, and it would be curious what would be the next leadership stand on reproductive health. We've come from the Arroyo administration that was largely anti-RH, the Aquino administration that passed the RH law. How crucial do you think these elections would be to ensuring that the Philippines actually moves forward in terms of reproductive health?
I mean, I think the leadership of the country obviously plays a huge role in what can be achieved, and I think what women practically will be able to access. I think that it's amazing that the RH law was passed, and we have a year left with this president, and I think, I'm really hoping that we'll see implementation, concrete indicators of implementation, and even some of the guarantees that are under the RH law, things like reviews of discriminatory provisions and repealing executive orders, such as what exists in Manila. I think there's a real opportunity, I think, for this president to make sure that the passage of the law is something that's his legacy and not just a footnote, that he was the president when this was passed, but then nothing happened.
Nothing happened, silence.
Yeah, it would be a shame, so much advocacy. And then, then what? What does it mean for women?
Yeah, and we'll see how the next president
Yes.
would actually handle the implementation of the law.
Yes.
Thank you so much. We've been talking to Senior Legal Advisor of CRR New York, Pyle Shah. I'm Ayu Macraig. Thank you for watching.